one of the things, I believe that one of the things that has allowed us to manage this pandemic in the way we have and to keep our overall numbers low is because we've had a coordinated provincial approach. And we have seen the numbers decrease as the testing capacity increases, as the public health teams are doing their work, as our businesses are opening and changing around the province in sync. And I don't feel that there's a differential risk right now. We are having low levels of transmission in parts of the province. We've had a couple new cases in the north, a couple new cases in the interior, but where the population is where we're seeing most of it. So at this point, this approach has really served us well. And I think we should have a continued approach unless there's good evidence that there's a reason not to. That would be my opinion. I haven't seen the letter from Mr. Wilkinson.
Just to say that we continue to appreciate and I think have a very good relationship with the parties in the legislature. It's absolutely reasonable to make suggestions. One of the things I'd say, though, about BC is what I was saying, I think, during my presentation, which is that one of the reasons we've been successful in BC is that all of the health authorities have worked together, including Provincial Health Services, including the First Nations Health Authority, and all of the different health regions. Well, they've all had different challenges. We've put in place very significant changes to support transportation to small communities, to rural, to remote, to Indigenous communities in the province. All of them have had somewhat different demands and challenges. Everyone has worked together to date. And this reflects, I think, something basic about the BC health system that Mr. Wilkinson and others will note, maybe even celebrate, which is that we have 5 regional health authorities. We have the Provincial Health Services Authority. We have the First Nations Health Authority, which gives us, I think, an advantage at the moment against other jurisdictions that have many, many, many more health jurisdictions, individual hospital boards, and so on. It's given us an advantage to coordinating and to have a one province, a single province approach. And so I think the approach that we're taking, which is to continue to view it in that way in this phase 2 period and phase 3 period, is the right period. But certainly the questions that are posed by Mr. Wilkinson and their team are reasonable questions, but I think our approach has been the right approach. It's the one that has yielded the best results, and it recognizes the potential risk in all health regions, and that, in fact, some of the health regions that have had the lowest outbreak have also had very significant cases and very unique circumstances that have required a remarkable public health response. And I can think of 1 or 2 in particular. I know the people out there will be able to identify their own. So, in short, I think our approach, our BC approach to this, which has supported every health region, which has responded to this in every health region, which tests in every health region and gives resources in every health region and has a similar response across jurisdictions, is probably the right approach for BC. But certainly it is true that that we've had fewer cases. Really, the farther you get away from the I-5 corridor here, we've had fewer cases. That's a fact. We've had more cases in Metro Vancouver. That's a fact. But it continues to be an issue in every part of the province. And I think continuing this approach with Dr. Henry and Stephen Brown leading the provincial response, with all of the health authorities responding, and with maintaining a level of care that deals with the concerns of all the health authorities at a high level, I think that's the right approach.